Hi guys, so this week we're going to talk about eating disorders. And the three main disorders that we're going to talk about are anorexia, bulimia, and binge eating disorder. And I want to start by thinking about how they're different from each other and then to focus first here on anorexia. So first, let's talk about what anorexia is, and then I'll briefly say what the others are in contrast. So anorexia is the eating disorder that many people think about when they think about eating disorders, and it is mostly characterized by restricting how much caloric intake you have, how much you eat, and so it's a restricting focus. And we correctly think of anorexia as being somebody of very low weight, or at least a lower weight than we would like. There's also a fear of gaining weight that is part of this. And so I'm just going to bring us out here for just 1 second to look at the diagnostic criteria for anorexia. Right, restriction of energy intake, and so by that we mean food. And so restriction relative to requirement. So different people are going to need different amounts of food and numbers of calories to eat, and so we're always looking at how much you need to sustain body weight. And so with anorexia, the requirement is that the restriction has led to significantly low body weight, that in terms of what's appropriate for the individual. And so that is, here we have the subjective less than minimally normal. We used to have percentages that we looked at compared to BMI, and now we're just saying low body weight compared to what we would expect. In addition, you need intense fear of gaining weight or becoming fat, or persistent behavior that interferes with weight gain, even though weight is low. So an avoidance of weight gain or avoidance of a higher weight is necessary for diagnosis. And then the other thing that's necessary for diagnosis is disruption in how you perceive or experience the size of your body, and lack of recognition that in fact that there's a low body weight. And so if we look at this, come back here quickly. So that's kind of what's described here. And I think we should pause here just for a moment to talk about the fact that when we talked about body dysmorphic disorder, we talked about similar alterations or disruptions to accurate perceptions of body. And so we talked then, and I want to remind you now that if all you have is the disrupted image of your body, and you're not restricting food, and you're not having low body weight, then you probably have body dysmorphic disorder. But if you have low weight, if you're making effort to control your weight because of the distorted perception of body size, then you have anorexia. And anorexia is going to be the first diagnosis we look at. We're going to rule that out before we consider body dysmorphic if the symptoms are just about body size and weight, as opposed to being about your nose or your ears or something that would be more clearly body dysmorphic disorder. So I just want to make that distinction. So bulimia, so anorexia is the restriction of food and low weight. Bulimia can involve some restriction, but it is mostly characterized by episodes of binge eating and episodes of purging. So taking in large numbers of calories, large amounts of food, and then purging those. And you need both the binging and the purging to meet criteria for bulimia. And we'll talk more about bulimia in the next video. And then binge eating disorder is binge eating without any purging, so just the binge eating. In both bulimia and binge eating disorder, we don't expect to see low body weight, and so that is an important distinction. So let's come back to continue talking about anorexia. As I said, we'll go back to bulimia and binge eating later. But remember, the distinction is anorexia is restriction of eating and low weight and fear of gaining weight. Bulimia, we don't necessarily see restriction, but we definitely see binge eating and purging, and usually normal weight or slightly high weight. And then in binge eating disorder, we just see the binges. We don't see purging. We don't see restriction, at least not as a major symptom. And we usually see obesity or at least high weight. So let's focus on anorexia. It's easy for us to treat eating disorders as we talk about them, as we kid about them, as we watch them in media, to treat them lightly in some way. And I think the most important thing we can know about anorexia in terms of how serious a disorder it is that it has 2 times higher mortality rates than any other psychological disorder we've talked about or will talk about. So as much as people worry about suicide, when it comes to depression, for example, that the actual risk of death is much higher with anorexia. And then in addition, the death rate for people with anorexia is 10 times higher than the general population. So if you have anorexia, essentially you're 10 times more likely to die than somebody without anorexia. So those are sobering numbers, right? Should make you pause and think about just how serious anorexia is. And then other physical consequences, some of which are related to the death rate, is that we get electrolyte imbalances. So electrolytes are those positive and negative ions that you probably had to think about when you were thinking about how neuron communication works. So those charged particles. So sodium, chloride, potassium, we need those to make neurons fire. You need neurons to fire to make your heart work, for example, but also to make your brain work. And so we get imbalances or disruptions in those because of the very low weight and lack of nutrition. Women who have anorexia are often going to show that their menstruation stops or gets disrupted in various ways, and that's related to the fact that we need certain body weight to maintain adequate estrogen, and that if we don't have that, we won't maintain a normal cycle. Lots of doctors, if a low-weight woman is presenting with fertility problems, many doctors, the first thing they'll say is for the woman to gain 10 or 15 pounds and then try to get pregnant for several months before they'll start fertility treatments, because loss of menstruation also means you've had loss of ovulation often. And therefore can't get pregnant. So that's an interesting connection there. We also see hair loss with anorexia, and this is just about nutritional issues, and gastrointestinal and kidney problems, again about nutritional issues. And we also can see something called lanugo, which let's try to open this up so you can take a look at this Wikipedia page. But you see this fine downy hair here on this page. Babies are born with fine downy hair called lanugo, and that we see that very commonly in people with terminal illnesses. And then disturbingly, right, we see that in people who have anorexia, and it's a very bad sign about where they are in terms of their risk of death. It's their body shutting down, essentially. So we can see that at the kind of later stages of anorexia. About 50 to 70% of people with anorexia will recover within 5 to 7 years, which sounds like good numbers until you think about the fact that that means 30 to 50% will not recover within 5 to 7 years. And for many people, anorexia is a very long, if not lifelong struggle, that even if they don't die from anorexia, they may spend a good part of their life struggling with the consequences of it and with the symptoms of it. So I'm going to come kind of through here. I'm going to kind of end our anorexia discussion on this slide, which is about the etiology of these disorders. We know that there's genetic evidence. We know that for people with anorexia, one of the other problems is that our body, in its attempt to comfort us, to bring us comfort when we're distressed, right? Your body, if you're starving, just makes this assumption that you're starving because there's no access to food. And so to deal with the discomfort of that, your brain releases endorphins, those feel-good hormones, feel-good neurotransmitters rather. And that means that when you starve yourself, if you're doing it by, as part of anorexia, that essentially the endorphins give you positive reinforcement for that. And there's also negative reinforcement for avoiding the anxiety that comes with eating food. And so in that way, there's this behavioral trend that also supports the anorexia symptoms and behaviors. So what I want you to do next is to watch the Laura Hill TED Talk that I have in the course materials. And there she talks about detailed information about the brain process, both about the experience, so I think that's important, but also from an etiological point of view, she talks about the brain process happening, especially for people with anorexia. I will, just a little caveat, at one point she's playing a tape recorder and telling you this is what the brain of somebody with anorexia sounds like. She really is not at all talking about hallucinations, which is a little bit what it sounds like maybe she means. What she's talking about is internal dialogue, the same kind of internal dialogue any of us might have, but a particularly problematic internal dialogue that people with anorexia might have. So go on and watch that, and we will talk about that specifically in our online discussion. But in the next video, we'll explore the other eating disorders a little bit more and talk more about etiology and treatment.